Okay, here we go. All right, I'm going to call the March 26th meeting, special meeting of the Macon County Board of Commissioners to order. The purpose of such special meeting is primarily for Macon County Public Health, Macon County Emergency Management, and Macon County Administration to update the Board of Commissioners on the COVID-19 situation in Macon County. As we all know, it's been ever-changing, and the information garnered is updated and changes every day. But with that being said, let's get the ball rolling. First item is for Macon County Public Health to give us an update. So, Carmine, are you ready?
I am,
Welcome,
sir.
Mr. Rocco, our
Thank you.
Health Director for Macon County.
Thank you. Good afternoon, Commissioners, and thank you for holding this meeting. What I would like to do is just spend a few minutes going over the history and the update on where we are presently for Macon County and the region as it relates to COVID-19. And I'm going to be using the PowerPoint that we have up on the screen. So just to start with, many of you already have a knowledge about the COVID-19 virus, and basically respiratory illness that's caused by a coronavirus is a family of coronaviruses, which was first discovered in Wuhan, China in 2019 towards the end of the year. The symptoms include fever, cough, shortness of breath, and usually when we're looking at fever, we're looking at 100.4 or 100.8, depends on the individual circumstances, but that's usually what we're looking for. The spread is from person to person, and it includes people who are in close contact with one another within a 6 feet distance. And normally the period of time is, if it exceeds 10 minutes or more, is considered close personal contact. This is a respiratory disease, and respiratory droplets are the way in which it spreads from person to person, and that's usually when somebody coughs or sneezes, and it could also land on surfaces and be picked up if the surface is touched and then somebody touches their eyes, nose, or mouth. As far as prevention, the biggest issue and the biggest method that we can practice right now is called social distancing, which we've heard many times, I'm sure, in the media. And this is basically a way in which we reduce the contact between one another, and we have 6 feet or more distance in particular. And then we also encourage people to not leave their home unless it's absolutely necessary, such as going to the grocery store, which are still open, pharmacies, if you're required to work in one of the fields that are necessary to keep as essential employment, such as a grocery store, that would be work. And then, of course, you've got medical concerns. You'd be going to your doctor or emergency room. We want to limit large groups and keep your distance from one another. We've talked about that already. And right now, I think we're looking at groups of 10 or more would be considered a large group. It has changed since the initial recommendations, but again, it's all precaution as we learn more. Washing your hands is one of the best ways we can encourage folks to prevent the spread. Soap and water for 20 seconds. If you don't have that availability, then at least being able to use a hand sanitizer which is containing at least 60% of alcohol or greater, and to make sure that you get your thumbs in that scrubbing activity, and that you, again, use that frequently, either washing your hands or hand sanitizer. And as I go through this, if there are any questions, please stop me. Thank you. Again, what we want to do is emphasize avoiding contact, stay at home if you're sick. That's very, very important. You could be sick with many things, and at this point, many times we don't know what it is exactly, but if it's respiratory illness, it could be flu. It also could be COVID-19 or some other illness. So we want people to stay at home, and then to avoid other folks if you're not sick, to avoid other folks who are, and avoid close contact. if you are sick and need medical attention, the thing that's most important right now is not to expose others, so to call your healthcare professional in advance of going anywhere so you can seek their advice. You can call them, the health department, emergency room, but do not go directly to the medical facility first. If you're ill, please call is the best suggestion right now. So covering your cough with a tissue or coughing, sneezing into your elbow, and increasing the amount of regular cleaning. Most disinfectants will kill coronavirus on surfaces, so if we keep things nice and clean, especially surfaces that are touched by many, keyboards, mouse, phones, things of that nature, that would reduce exposure. The national picture, if we look at the progression of the disease, you'll notice that back on March 3rd, we had many of the border states starting to show evidence of COVID-19. That's March 3rd. 15 days later, approximately 2 weeks later, you can see how the country has been filled in with a lot of the folks in the southern part of the country, as well as the, again, coasts showing larger numbers of infected individuals. But it is a fast-spreading disease, and it's one that has not seemed to be stopped by much other than social distancing, and that's still something that we need to practice. Again, looking at our March 25th picture, we're looking at some large numbers. You can see on the East Coast and the West Coast, and then in Texas. Right now, I think these numbers have actually changed since yesterday. I believe we're over 1,000 deaths in the country, and the number of cases has also increased. It increases dramatically. Even there's concern about it doubling every 2 to 4 days, and it doesn't seem to be slowing down much of any. If this is a picture that I really wanted to spend a little bit more time on. If you can see the various states, and I think we're a little bit off the, I don't know if that is affecting your picture, but the Tennessee portion of the map is cut off. If you can see that spread of disease on the different states that we have here, with 667 cases as of March 25th in Tennessee, 1,247 in Georgia, 342 in South Carolina, and 608 in North Carolina. If you can see here, I don't know if I can put my marker here. Right in this area here is a basin, if you will, of Macon counties here, and then we have other counties around us. This area right here, as well as up the mountainous border between Tennessee and North Carolina, is relatively free of COVID-19 disease, at least at this point in time. What concerns me and others, and I think even we had Commissioner Gillespie mentioning this idea of how this might move, the COVID-19 disease might move towards areas that are not infected currently. What I'm referring to right now is this area that we're in, which to me looks like a basin, which is more of a catch basin, if you will, of people moving from areas surrounding us into areas that are not infected. And that's a big concern because we are less populated, we have less of a robust healthcare system, and we're seeing people from all these various states and other states such as New York and Florida, Illinois, coming to this area or surrounding area and then traveling within that region. As we've been told, and we know that the science bears it out, that social distancing and traveling is not recommended. Social distancing is, traveling is not, especially if you're ill. But what we can see here is that we are surrounded by COVID-19 in pretty large numbers in all the states that surround us, including those states that are, you can't see on the map, but obviously we have folks who are coming in here for various reasons. Actually, on the way in, I just saw somebody with a just married sign on the back of their car with an out-of-state plate. So I know it's happening. We've had reports of it happening, and people are apparently moving into our area temporarily to avoid these other areas of higher spread, which brings the risk to us to some extent. The other thing I want to take a minute to talk about is in this area, we have a certain number of hospitals and certain number of healthcare providers. The hospital setting is such that if you look at this being a picture of a river or series of rivers, and the Asheville area being a catch basin, as the hospital in Mission, or at Mission, becomes more full with individuals who are ill, they can't receive more individuals from the hospitals that are extended out in the other counties that surround Asheville and who are part of the HCA and other healthcare systems. So if you look at that as a catch basin, as the Mission system gets full, it will back the rest of the systems or the rest of the tributaries and streams up. And that means the folks in other hospitals upstream, such as ours, will have less of an opportunity to transfer patients who are ill to the catch basin or Mission. That's a concern. And when you don't have beds and rooms available to isolate or ventilators to take care of folks and they have nothing else, no other place to go, we have a healthcare crisis. As far as tests go, I wanted to show you that here are the different testing done by various states, with 667 in Tennessee with 2 deaths, and in Georgia the 1247 with 40 deaths at the bottom, you can see that, and then 608 with 2 deaths in North Carolina, and then 142 with 7 deaths. And the reason South Carolina has fewer tests is that they only use state-provided tests. They don't use private labs. So that's why that number is dramatically slower, or lower, I should say. So these are the number, I should say, of the cases in those in those states. The tests that have been completed, you can see Tennessee, large number, Georgia and North Carolina coming up with over 10,000, and then South Carolina again because they're using state tests. This regional picture, you'll see the map on the right shows us different regions in our state, mostly in the west. Region 1 is where we're found, 2 and 3. If you look at the graph here, this line, green line going pretty high up, is the state. And then if you look at the other 2, region 1 is us, and that's down here with a fairly lower number, and then region 2 is slightly higher and going up. I would just also like to say that in the testing that we are doing, we first test to see if people have flu before we test for COVID-19. And the flu is showing up in our testing. Flu is not out of the realm of possibility in this region. So flu could also be a problem for folks, especially if they didn't get a flu shot. And we're trying to screen out flu first before we use COVID-19 tests. This is what Macon County looks like as far as our testing. We started on the 11th and have progressed since then. The blue are the tests as far as the negative tests. If you see, oops, that wasn't too good. All right, if you see the green, those are flu tests at the bottom. And then you have the COVID-19 tests that are pending, either at LabCorp or the state. So our biggest day was the 16th, and then we've had steady numbers of tests that we've been doing since. We are still waiting for several of the test results to come back, and we feel like we still have some time before we'll see the rest of the picture pan out. But as of this date, we have no positive tests in Macon County residents. None whatsoever. And that's good news on one hand. On the other hand, we did have some travelers who came through who were positive that we were involved with. So we've done 56 tests, and we're still waiting for results on some. Last thing I'd like to just point out, we have some information for folks who are interested in finding out if they've been affected by or infected by COVID-19. If they have fever, coughing, difficulty breathing, they can contact us or the local healthcare provider. The call center that takes the number for, or takes the individual's concerns is 828-349-2517, is for us to get information to our EPI team and to the healthcare providers in our department. If you'd like to speak to somebody in our our call center, we're there Monday through Friday from 8 to 5. If you want to talk to somebody at the state level, 866-462-3821. And I just wanted to show that we've had a good bit of activity going on. The call center was activated on March 12th, and we've received 360 calls to date, well, to the 25th, and they come in every day asking questions about COVID-19. We also would point people to our Facebook page, and that's where we provide a lot of up-to-date information and answer questions on occasion there, but there's a lot of information changing rapidly. The disease is a rapidly changing disease in that it's spreading, and even some younger individuals are starting to show disease. It's mostly concern, though, of those who are 65 and over with underlying health conditions, such as heart disease, lung disease, diabetes, if they have immunocompromised situations. It's also a concern for those folks who are in nursing homes and in some of the assisted living facilities. So we're trying to look at not only protecting the public and those high-risk individuals, but also have to be concerned about the healthcare workers, and that if we have healthcare workers more and more affected and have to be quarantined, that reduces our ability to respond to the surge of individuals that may come in if we don't have limited numbers of folks or stop the number of folks coming in on a regular basis with disease or have been quarantined and are not following the quarantine procedures. So it makes it difficult if our system gets overrun with folks. As I described, the catch basin theory that I like to look at, we don't have a lot of surge capacity in the system to take a great number of folks in without having difficulty responding, and that could put somebody's life at risk. It is my belief that if we don't get some relief with the travel and as well as the individuals coming to our county, that there will be, unfortunately, deaths that will be occurring in this area because some folks are that ill, will become that ill, and they may not be able to find health care quick enough, or if we have a run on health care here, they may not be able to get in fast enough to get service. So,
Carmen,
yes.
Mr. Chairman, was part of a call with Dr. Elizabeth Tilson. She's the Chief Medical Officer at North Carolina Department of Health and Human Services. As of 2 o'clock, 636 cases, 57 counties, 50 people are hospitalized. Most of those are in intensive care. The average age in the intensive care is 41 to 50. Those who have passed away in North Carolina, the average age is 40 years old. There have been 15,400 completed tests that are negative. There's over 15,000 tests still pending. So, how long is it taking to get our test results back, Carmen?
It's several days. My other expert here is Director of Nursing, Jennifer Garrett.
So it's taking from the state anywhere between 2 and 3 days, but if we send them to LabCorp, it can take anywhere to 5 to 7 days.
So where are you sending most of them?
Well, so most of our tests have been going to
Why don't you come up?
LabCorp.
Come on up here. The radio needs to hear you.
Most of our tests have been going to LabCorp, and the ones that have gone, like I said, have taken anywhere between 5 to 7 days. There's a backlog at LabCorp right now, and they're aware of that. They've been working to get more people there. They thought by Wednesday they would have some of that eased up, and it's not eased up as much as they thought. So they're running tests as fast as they can.
And I take it we're still under the same guidelines to get a test? You're showing symptoms?
So the way you get a test is if you have a fever, lower respiratory symptoms, and a negative flu is what we're using as our criteria. When you call in to be screened with us, we'll go through a screening process. We'll ask you a bunch of questions. It takes a few minutes to get through. And then based on what you give us for symptoms, we run it through our criteria, which is the fever, shortness of breath, lower respiratory issues, and a negative flu test.
And how many tests do we have on hand?
Oh, I don't remember when I left
I
today.
think it was over 20 at the last count.
How many, Carmen?
Over 20.
20.
Mm-hmm.
We got more ordered, of course.
Yeah,
Hunting more all the time.
hunting is
Hunting is the key word.
hunting is the key word.
And we do several tests every day, and have for
The testing,
couple weeks now.
yeah, the testing waxes and wanes. We have days where we have more and days where we have less, but we're testing. We have a test at least every day.
And our department's totally committed to this effort. We're basically just doing COVID-19, and it's a challenge to keep up with everything that's going on. And it's been a long haul, and we believe, at least I believe, that this will not stop anytime soon. I would like to believe it would, but I think we'll be dealing with this long term, which to me will be many months. Could be until we have a vaccine, which is projected anywhere from a year to 18 months from now to have a vaccine. And I believe we'll be involved with that very much so as a public health measure. Once that vaccine's available, we'll probably be doing vaccination clinics or mass distribution of vaccine as a way to stop further spread and to help people hopefully return to a normal
And as
life.
further evidence, this is no respecter of persons. Our state treasurer, Dale Fall, is being diagnosed with COVID-19. He's full blown with it. So, and all this Treasury Department now, it don't pick and choose.
No, anybody can get it, and it's concerning when you have what we thought were younger people were being less affected, but what you just gave in the way of data shows that may be shifting. Viruses have been known, especially flu viruses, to mutate. We don't know yet about how this virus is going to act over the long haul. They were told initially that 80% or 81% of the folks who get COVID-19 it's a mild illness, and then obviously 19 to 20% will have more severe illnesses depending on their health background or condition. So we could be looking at a good number of folks, if that is not holding true, and it's going throughout the whole population and age ranges as well. So it just depends on your individual circumstances as to whether or not you're more at risk. If you're younger and have those same health conditions, you are at risk. So the best message we can send right now is to stay at home, stay at your home unless you have to go out. And this is not a long-term vacation approach. This is not a long-term blizzard. This is a long-term health illness that is not going away anytime soon. And we can't stress enough, it's serious, it's to be taken serious, and we're putting people's lives at risk, such as law enforcement, EMS, healthcare providers, nurses, doctors, you name it, if people don't take this seriously and stay home and follow the precautions that have been put out by CDC, the state health department, local health department, their doctors, and so on and so forth, medical community. I can't stress that enough.
All right, thank you, Carmine. Any further questions, Mr. Rocco?
I've got
Commissioner
one.
Shields?
For the public information, could you just say what your Facebook name is, like at Macon Public Health? Or-
Yeah.
Well, I think I hear you saying this is updated every day. What we've seen here today, it pertains to in the moment. But tomorrow morning, if I look at this, or tomorrow evening, it may show something different.
Yeah, we update general information. We don't usually get into all the testing numbers on our Facebook, but it is Macon County Public Health.
Macon County.
Public Health is the Facebook name. And people can go there and see what the latest information we are publishing. And we've been using Facebook quite a bit and been getting good response. And we're trying to work with other systems as well, like the school system, and sending out informational sheets with the food that's going out to every household, or those households that are receiving food. So information is key. Rumors are rampant, and we need to combat those rumors with facts. So please call us if you're hearing rumors, because this will help to dispel them. Thanks.
Hey, Sir, Carmel, one more question here.
You got any questions, Carl? Go ahead. And then I will. You know, I'm gonna have questions.
Okay.
You know, nobody understands this coronavirus. We've got models, we've got scientists, we've got experts predicting what's going to happen. And I think one of the reasons that we're successful in Macon County, your geographical approach is a good example, but I think people are very conscious. I think personal responsibility has been a great asset in Macon County. Everywhere I go, and I'm out all the time, I'm going. And it's amazing. There's always going to be that small percentage that, they're lame brains. But I think personal responsibility, we ought to credit the citizens of Macon County for the attempts, because it's really affecting our daily lives. Now, state requirements, I just read this quickly. The state requirements, what I'm seeing is hodgepodge approaches at every county, every town. Highlands is shut down. Haywood issued today
I believe.
stay at home,
Right.
shelter in place.
Right.
They've identified essential and non-essential services in the private sector.
Mm-hmm.
There needs to be, it looks to me like some uniform approach to this thing. Now, the governor, I think, has issued that hotels are essential services.
Depends on if they're housing, say, for example, medical providers who are coming into an area to help out, emergency personnel. I think in some cases where you might have construction going on, but by and large it's for, I think, those who are responding to the COVID-19 outbreak.
But there's been no blanket shutdown of motels across the state, is that right?
To some extent they've been shut down. You're looking at Airbnbs, RV parks, things of that nature too. So there are a number of places that are being shut down, and it's more to focus in on people, for example, who are homeless or need some place to stay temporarily in an emergency situation. We have that going on in our county too, where there are homeless individuals who need to be put somewhere temporarily if they're quarantined or isolated and don't have some place to go.
Okay. And then the mass gatherings, I think the state's still at 100,
They dropped it to 50.
dropped it to 50.
That's correct.
So what is our science to say we're going to do that to 10?
Well, I don't think there's as much science to the 50 or 100 that I'm aware of, and the 10 was recommended actually by CDC now. So I think once we see CDC adopting that, the science is more likely to have been applied in that number. And of course, it's exponential, so the more people you have, the more risk you have. So if we can reduce the number of people, we reduce the risk. That's the way I think we're looking at the scientific basis of why we do what we're doing.
And this is a serious thing, coronavirus, 1,000 deaths nationally. I just checked the CDC numbers on the flu.
Mm-hmm.
As through October the 14th, it was 23 to 59,000 seasonal flu deaths. Not comparing the two, but we deal with viruses. The coronavirus will be a seasonal virus in the future, more than likely, or maybe not too distant in the future. The thing that concerns me, and I appreciate your approach from a safety and health standpoint, but from an economic standpoint, and hopefully y'all are figuring that in, because tomorrow 3.2 million new people in the United States won't be getting a paycheck. Won't be getting a paycheck next week probably as they file for unemployment. Hopefully this stimulus bill will get to them sometime. But I work with a lot of people in the private sector, go from week to week. Everybody here, you can pay private people $10,000 a year or $50,000 a year, they're going to spend it. That's what it's for. So this is having a major economic impact. And we've had one state of emergency, and now we're going to amend it to tighten it a little bit more. What is the long-range plan? You were saying this thing could go for 2 years, or for years. How are we factoring in the economic impact and comparing that to the health issues? This economy can't be shut down for months.
Right. Well, let me see if I can address that. If in looking at spiking with disease, the rapid increase can put us at risk of our healthcare system failing. If the healthcare system fails, then the economics of it will be even more drastic in that people will not be able to recover even at any point because they have no healthcare system intact yet to help them, especially those that are the most severely ill. So the reason we're doing the activities now of social distancing, hand washing, and so on is to reduce the peak and to flatten it out. You've heard many times, flatten the curve. It's to extend it instead of surging it. So if you're surging it, what you're doing is you're putting extreme stress on in a short period of time instead of spreading it out. People are going to get sick either way, but if you don't have a surge and a spike, it won't overwhelm the system, and that will have an economic impact not only on the healthcare system, because you'll lose staff, you'll lose the ability to maintain a ongoing response. What that also does is your community then has no place to go. It can continue to spread out into the community, which means more and more people are affected. They can't go to work. The healthcare system can't perform. So now we've got even fewer people able to respond, and it will continue to grow. As it grows, we don't know whether it will increase and at a point and then stop and start to go down like a flu does. We at this point would expect that it will eventually flatten out, but we don't know that yet. We don't have enough history.
Eventually it will.
We hope.
Defining eventually is the issue.
Exactly. And what I'm saying is there's two benchmarks here. One is when they come up with an effective treatment, which they're trying. The second is a vaccine. The treatment looks like it's closer than the vaccine. The vaccine will prevent future illnesses. The treatment will take care of those that are currently infected. So when you look at the economics of it, it is how quickly can you as a community respond to a surge of illness? That's one. Number two is, if you look at what it's doing to closing places, the longer you have the illness in your community, the longer those measures of keeping people out of your community or closing businesses down will take place, which has the long, prolonged economic impact. So it's beneficial to us to shorten the period of time that people are sick, if at all possible. The only way to do that is to blunt the spike and have it start to trim out. If we can get the vaccine and the treatment in place, it will start to drop off, and you can then resume more normal activities quicker. But the longer it continues, the worse economic impact it will have. And I couldn't agree with you more about that. That's a big issue. But Macon County residents have not been the ones who have been ill. I mean, with COVID-19. They may have the flu and we don't have a documented case yet. But what we are seeing is it's folks from outside who are coming in with the disease.
We've had two of those?
Yes.
Two or one?
Well, we've had one.
One.
We have two.
We had one, and then we had one who was treated here, but is living in another county.
Yeah. So we've had one, and that was 10, 12 days ago?
Yeah, they're out of
Yes.
Yes,
Yes,
now.
they're out of isolation. And then the one that was treated here, of course, while they were here, exposed people here. So, I mean, obviously when they went to get health care, those people came in contact with them.
Carmen, is it true, I think I read it at CDC, the flu, Commissioner Higdon mentioned comparing this to the flu, but I think what I'm reading, the biggest problem is less than 1% of those who have, way less than 1%, who have the flu end up in the hospital or ICU. we're at 20% of those who have this end up in the hospital. So it takes a lot less people to overwhelm our system. Is that pretty much?
Yeah, that's correct. I think the other thing to notice is we're having, we're on our third spike of the flu. We've had one spike, we've gone up through a second and down, and now we're on regular flu, we're seeing a third spike. That's really unusual in my experience. We've had 2 spikes normally, early on, and then about January, another spike, and then it trims off. We're starting a trend upward now with a third round of flu, regular flu. So that's also underlying what's going on. That's one of the reasons why we test for flu first before we go with the COVID-19 test.
Much more common.
Right, and we eliminate that. So, possibility, but we're still concerned about the influx of individuals coming in to the area. And you're right to give credit to where credit is due to the residents of taking heed, but you also got to be continuously and consistently practicing this social distancing. Otherwise, it will not work. And we will have spikes and more infection. So unfortunately, human nature being what it is, a beautiful day, you want to be out, you want to enjoy being out. But we can't continue to do that as a normal behavior and not expect people to get sick. If we were to hang in there for a couple of weeks and follow it closely with the social distancing and staying at home, we might be able to see a more dramatic decrease. But staying at home refers to more than just Macon County folks. It refers to everybody in the country. That's what's being promoted, is not just one area or another, not just one state or the other. It's everybody in the country staying at home. Coming here because it's a neat place to hang out for your quarantine or your isolation is not a good idea. It's not a good idea for the person, it's not a good idea for the community, and it's not a good idea for the healthcare system. Because we can have people, such as our nurses, having to be quarantined because of exposure, because somebody didn't pay attention to that rule of staying at home, and now we've got to quarantine that person, that nurse, for 14 days. That also has an economic impact, because now you have to either do with one less nurse, or you have to find another nurse to bring in.
I think this needs to be reviewed before 14 days. That's what, I just quickly read through this, that
Before the April meeting, is that what you're referring to?
that'll be 3 weeks from now. In 3 weeks, people unemployed, 3 weeks locally. That's a long time.
Who are we unemploying?
Every retail business,
We're just talking about short-term vacation rentals.
but the effect, yes,
I see what you're saying, the effect of it.
The
I'm with you.
effect.
Okay.
even in the Highlands,
Okay.
every retail business in the Highlands is shut down except the
right.
banks and Reeves Hardware. And the construction industry just happened to get shut down because they're checking your license as you go into Highlands, and 50% of the construction labor in Highlands is illegal immigrants. They're not going through a checkpoint. They're going to hit the road back to Franklin. So this is affecting 3.2 million people file for unemployment. That's what it spiked up. That's the first we're into what, day 9, day what?
Of the 15 days that the...
Yeah.
Well,
Who knows it's 15 days?
that's what I think the
That's a number
president's
made up.
plan of
Yeah.
15 days.
Nobody knows about this stuff.
That's why we need to take every precaution we can. If it's 21 days, we do 21 days. If that's what,
Yeah.
we'll hear from Warren Cade, and that's what we need to do.
That's been going on for a lot longer than 15 days. This is a problem that started back in the beginning of the calendar year.
I'm gonna try and just move us along. We've got a lot to get through still. Carl, do you have a question? Do you have another
Yeah,
question?
would you mind
Commissioner
going to your
Higgins?
slide that shows the states, the numbers by state?
By state, with that,
Keep going. Keep going. There. Whoops, come back, please. When you're comparing these 4 states, specifically a couple questions, North Carolina, 2 deaths. When did those 2 deaths occur?
in the past 2 weeks.
One
We
this
had-
morning.
Yeah, we had one last week and I think one this week.
Okay. One one last week and one this week.
Correct.
And of those 2 deaths, did those 2 individuals have pre-existing conditions?
That I don't know.
The one that died this morning worked for the city of Wake County. I don't know what kind of condition he was in.
Yeah, actually, I think there's a third this
This will be
morning.
the third.
Was it Madison? No, which
No.
county? It was Cabarrus?
The
One
two
in
were in
fact.
Cabarrus County, and I don't know where the one was this morning.
But we're not privy to the details, at least that, we haven't been told any of that.
And when you look at the number of folks that have it versus death, and you compare state to state,
Mm-hmm.
would you care to speculate on why Georgia's numbers are significantly more than the other 3 states when the number of tests that have been in Georgia don't coincide with the number of illnesses?
I see your question. I think more of the case spread is due to the population density of places like Atlanta and other locations. I think if we have the map of the different states, let me see if I can get back to that. Yeah, this map here. The number of cases, I think, are greater, and especially, I believe this is around the Atlanta area, or thereabouts. But these folks are more densely packed in there than, let's say, some of the areas out in Tennessee.
So
It's my speculation.
Kind of the way I read it. So would it be a fair statement to say that in the larger metropolitan areas, it would be more logical to be more aggressive with restrictions than in a rural setting? The numbers would seem to indicate that would be the case.
I think on the surface, it makes sense. I think what we have to also consider, it's like squeezing a balloon. The more restrictive you are in one area, it forces people to leave and go to others. And so even though we're not as densely attributed to having a dense population here normally, the more restrictive in other areas will drive people from that area. And we've had anecdotal evidence of that where people have said, the reason I'm coming here is because we're less restrictive and I could do more and enjoy more here than I can back home. So that's the kind of cascading and unintended consequences that take place when you start. And your point about consistency is very important too, because as you do this in a patchwork way, you start to force people through being human nature to look for other alternatives as to where I'm going to spend my time.
Is that proven? Do you have statistics? I mean, is that just conjecture?
That's my conjecture right now, but I believe we can find data that support that. I don't think that's an abnormal conjecture of what
Certainly the
happens.
conjecture, the New York Times this morning listed us as a place to go to.
There's been articles about people
reads that.
going to second homes and things of that nature. And we want to welcome everybody. I know working in here for almost a year and a half, this is a great place to come. A lot of folks enjoyed here. They're very welcoming. This is the time to preserve what's nice and come later. And I think the sheriff was right on target, if I can take that for a moment, to say, if you stay away now, you can come back later and things will be better. I think that's a good way to look at it. These are short-term measures, but we've never experienced anything like this. So first off, we're in a fast food mindset. So short is a day. Now we're going on weeks, and that's definitely a different perspective.
One last question. I'd just like your perspective on this. There's obviously many second and third homes in Macon County that are occupied today that I would suggest were not occupied on this date last year. and we can debate why that is, but I think that's, I don't think there's a question about that. And they're, it's been suggested they're here because they don't want to be in Atlanta or wherever. And they're, I went by, and I'm not picking on any particular company, but I went by Lowe's, and I was just absolutely amazed at the number of vehicles at Lowe's. And I didn't see anybody going in to Lowe's or coming out that was practicing social distancing. Have you got any thoughts on how we could approach that without interrupting the flow of commerce at Lowe's? And I'm just picking on Lowe's, there's others, but.
Well, I think you've mentioned personal responsibility. And I guess what I would say is if we look at this as an extended family and people love to come here and visit their extended family, would you put your grandmother at risk? Would you put your grandfather at risk? Or a sick uncle or a sick aunt because it's just fun to go out and shop, or I got nothing else to do with my time? No, you wouldn't. I think it's a matter of personal responsibility now. It all boils down to, you have laws for lots of things. If people choose to disobey them, then it's up to us to enforce them. However, it starts with a common belief that we all have a civil responsibility to look after one another. I am my brother's keeper. It can never be even more true than it is today. And I would just say, appeal to people's sense of civility, sense of community, and sense of responsibility to one another, to understand that what you might be doing today will affect my family tomorrow. And likewise, if I took the same attitude that I don't really care if your family gets ill, how would you feel about that? So I think we have a lot of good people in Macon County. Believe me, I've enjoyed working here. I'm staying at Hampton Inn right now because it's hard to keep going back and forth, but it's been a welcoming place. I can see why people want to be here, but they have to understand this is a short-term sacrifice for long-term gain.
All right, Emergency Services Director, Mr. Warren Cady.
Thank you.
Welcome, Warren.
Thank you, Mr. Chairman. And Carmen, can I leave that slide up there for a few
Sure can.
minutes? Let's just leave that where it's at, if you don't mind. Very quickly, for my part of this presentation, let me go over a couple of things that our office is doing so you understand what our part of this process is. Typically, your local emergency management agency is your logistical coordinator for an event like this, where we're trying to get the resources to the people that need certain things. In this particular case, it's usually medical supplies and PPE. And then taking a step back and looking at the 3-month picture or the 2-month picture or the big picture of where we need to be. And just as an example, we are the connection to any of the resources that you hear about as far as the North Carolina stockpiles, the medical equipment, the PPE that is either already acquired by North Carolina Emergency Management or is in the process of being acquired by North Carolina Emergency Management to supply local agencies and groups to deal with the healthcare emergency. And that also includes the resources that are available to North Carolina from the federal government as far as the Strategic National Stockpile and the resources that are in there. We actually are tasked to do a lot of different resource requests, and that list has been growing by the week. Typically we'll do your local agencies like the health department. We've been working with the hospitals. Now we've actually been tasked with your local private providers, your physician offices when they have issues with supplies, even your hospice agencies. We actually got tasked with, we're the third tier of resource requesting and acquisition for the school system. With the meal process that they have going on now, obviously they have a source for their food. If they run into some issues with that, they're to attempt to acquire stuff locally, and if that doesn't happen, we're the next tier for them to go through our process through North Carolina to acquire resources for them to continue the feeding program. Unfortunately for us, they're very well equipped to do that at the moment, so we haven't had to actually do that. We've also been tasked with, daycare has been an issue with people that aren't working. There's been some movement with the state to direct Smart Start agencies to sort of oversee the daycare agencies and child care and make sure that they can remain open and they can keep the resources they need. And we've actually been tasked with that if there are any issues that they have on their end, then those requests will come through us and we'll have to put those through into the system to try and acquire those. Just a real quick example to kind of reiterate the issues that you're hearing from the media as far as supply acquisition. And a lot of these are coming from the hospitals. A couple of questions we always ask these agencies, and they're required to submit to us before we put something in the state system, is we want to know what kind of PPE you have on hand, what's your daily burn rate, how many do you normally go through on a day, have you attempted to acquire those from your normal suppliers, and what have they told you? And once we get through that, then we process orders and put orders in and see what we can find. The hospitals actually developed a 60-day burn rate for their facilities. So both facilities presented us with numbers over the next 60 days. What do we think we'll need, so we can start planning now in case the worst case scenario, so we can start getting these things. Now, obviously, this list is not all inclusive because they either have supplies on hand or these agencies have been acquiring them from their commercial suppliers. EMS has been able to acquire some stuff from our commercial suppliers, even though we may have had to change the brand that we use, or the delivery times have been extended compared to what we normally would get. But some things you just can't get. We've had delivery dates that we put an order in, and it may say delivered Monday, and all of a sudden that Monday goes to August. So we've hit some issues with that. But here are some examples that I wanted you to hear on what the supply chain is. Through the North Carolina system, over the course of the last 5 days, we've put in an order for mask, face, and eye protection totaling 30,370 devices. Out of that 30,370, we have received 353, which is 1% of what we requested. We had one facility with the 2 medical facilities and some other small ones had requested 1,400 gowns, which is the protective devices you wear whenever you do particular aerosol processes. We wanted 1,400 of those. We actually had that was probably our most successful. We got 370 of those, which is 26%, which on a good day is still not a good percent of what you want to order. We asked for 16 PAPRs, which are your positive air respirators. If you see your healthcare workers on TV wearing something that looks like a helmet, that looks like a spacesuit, that's your PAPRs. That's the more advanced protection for your healthcare workers that are dealing with infectious diseases. We asked for 16 of those, and we have gotten 0. North Carolina, over the course of the last week, they've issued somewhere in the neighborhood of $60 million in purchase orders for equipment, personal protective equipment, other supplies, and actually ventilators. They've attempted to acquire a fairly significant portion of ventilators for North Carolina. We submitted a request for 10 of those. We wanted 5 for Franklin and 5 for Highlands. We got 0 of those, and we were told that we would not be getting any of those until we started to see an issue with the population here and the demand that we have. COVID test kits, obviously they've got other sources that they can attempt to get some from, and we've actually figured out the system. The system was only supplying basically a 48-hour supply of equipment. If you asked for anything more than enough to get you through about 2 days, it would basically just sit there and you weren't going to get it. So what we learned was to start putting our requests in for that 48-hour order for them. In addition to the ones that they've already got, we asked for 110 COVID test kits over the period of the last 5 to 7 days. Out of that 110, we got 19, which was 17% of the amount that we had actually asked for. So when you look at all those numbers, that's not a really good average of the things that we've been able to acquire for these folks. I know we usually get asked the question, what's your volumes doing with your other agencies? So we actually went back and pulled some statistics. And as far as EMS, we actually pulled a sample week. We looked at this past week, the last 7 days with EMS, and then we actually went back a year ago and looked at the same week a year ago. The total number of calls is actually fairly similar. There were roughly 121 this past week, and there were 118 that week a year ago. The big difference that we have seen is there's roughly a 50% increase in the amount of respiratory difficulty calls that we responded to in the last 7 days compared to that same 7-day period a year ago. Something that I'm not sure how to figure out how this number came about, and I don't know that I can even tell you that it's related or not, but it's significant. There was a 400% increase in the number of chest pain calls that we responded to over the past 7 days compared to the 7 days a year ago. The one number that's also, it looks better on paper, but there's a reason for it being here. Our interfacility transfers, which are our transfers from our local medical facilities to other medical facilities in different counties, are actually down by 39%. And that actually sounds good, and it does help us because that allows us to have more of our resources here. But most of those other facilities are either doing reduced procedures or they have cut out doing procedures, and there's no place for those folks to go to be transferred out. So that seems to be indicated in those numbers from those interfacility transfers. The one thing that we have noticed is, and we anticipate this to increase, is our on-scene times. We monitor our shoot times from the time we get notified till we get out the door, our time from when we get out the door till we get to a house, and then our on-scene times from the time we get to the scene until we leave to come to a medical facility. We've noticed an increase in our on-scene times, and we anticipate that growing because of the precautions we're having to take we'll send one person in a house to evaluate certain calls, and then depending on the situation, we actually have to don and doff personal protective equipment that we might not have necessarily been needing before. So one thing we have seen is that increase in our on-scene times. The 911 calls, the calls that are actually coming into the center for things other than medical calls, are actually down about 15%. We picked days for them. We picked one day this week and compared it to one day last week, so we're actually down a few of those numbers of calls as far as the stuff that's coming into 911. So with that's the update on what we're doing as far as logistics, and I guess we'll move on into the rest of this, and then I've got some more information to bring back to you a little later in the process.
Thank you, Warren.
County Manager, Mr. Derek Rowland.
Thank you, Mr. Chairman, and I will be really brief. First and foremost, I just want to thank all of our law enforcement personnel, emergency management, public health. They have been very, very influential in this process, and they're on the front lines of this thing. So kudos to them for the great job they've done. Kudos to the Sheriff, Warren, Carmen Rocco, for the open lines of communication they've had, not only with their staff, but with the organization, so we can all stay on the same page as we work through this together. Just to bring you up to speed, and much of this I have told you last meeting, I'll just briefly reiterate it. We have been taking steps as much as possible to observe and to acknowledge the risk that the COVID-19 pandemic poses to the citizens of Macon County and those that work in this organization. As county manager, the top priority that I have is the health and safety for the Macon County employees. We have taken steps to ensure that that is protected and we can preserve that as much as possible. In taking these steps, which I'll briefly go over, we've been able to continue operating on normal business hours in most of our departments with very few changes. Any changes that have been made as a result of this can be found on the Macon County website, as well as the information that Mr. Rocco pointed out that can be accessed on the health department. You can get there from the homepage of Macon County. But he said something, and it's very important that we remember that there are all kinds of sources for information in this thing, and rumors get started, and things start getting said on Facebook, and everybody is wondering what's going on, and where can we get this, and what's the county doing. The Macon County homepage has up-to-date, current, and accurate information on everything related to the COVID-19 pandemic in Macon County, and it can be addressed there. Organizationally, we have identified within each department those individuals that are deemed high risk under the CDC guidelines issued. For COVID-19, we have also assessed their need as well as their accessibility to be able to work from home should that event arise that they have to do so. We have been able to, within all of our departments that are central to the operation, of the organization. In other words, the departments that act as a resource to all other departments, i.e. payroll. We have made sure that, and working with our IT staff, who has been great, and I cannot thank enough for the work they have put in with these various departments on assessing these work from home capabilities and making sure they're up and ready to go should that need arise. Again, getting back to things like payroll, we have made sure that there are mechanisms in place. So, should someone have to go out, or should an area have to be quarantined, or someone have to be quarantined that has came into contact, we have the mechanisms in place and are able to do that from home should that need arise. So we've taken steps to identify these critical processes and make sure that we have alternate means for accomplishing them throughout the organization. Other things we've been doing, things such as temperature monitoring. Many departments throughout the organization are monitoring their temperature. They're taking the employees' temperature when they come in at work daily and logging that. Protective measures in many departments have been put in place. In building inspections and environmental health, we installed a temporary glass fixture there to, again, provide a barrier between the public and the Macon County employees, keeping both safe should something have been contracted or that need arise. We have enhanced our cleaning and sanitation efforts. Maintenance has remained at the front lines of this thing as well, and they need to be commended. The maintenance staff has went above and beyond. Many of the departments that have closures, they're assisting maintenance in various aspects, cleaning buildings, so on and so forth, to make sure that we are as sanitary as possible as we address this. The only closures that we have right now, again, this is available on the Macon County website. Of course, the Senior Services Building, that building is closed till further notice. Congregate meals are now being served via drive-through and delivery. That's with the assistance of transit as well. So that's another example of how departments are falling in and working together. Macon County Recreation, the Robert C. Carpenter Building, Highlands Recreation Park, and Nantahala Recreation Park. Those are all closed until further notice. Macon County Emergency Services, the Barrett Building is closed to the public. As Warren said, that is our operations center. That is the central hub. EMS bases as well closed to the public until further notice. Macon County Transit is running as normal, with the exception that the Mountain Gym route is only running 1 time per hour instead of, as it normally does, 2. Macon County Detention Center, the sheriff has worked real hard along with our medical staff at the detention center to put in place some things that they feel will alleviate any problems that could arise as a result of COVID-19. I know they've put some measures in place specifically regarding visitation, and it is the sheriff, as he'll tell you, his main priority to keep the inmates safe and healthy that are in there. Macon County Veteran Services, as they are located in the Barrett Building, they are continuing to provide services, but they're doing that at this time via phone and email to the veterans in the county. Macon County Public Health has limited non-essential services, as it is, of course, focusing primarily on this effort to try to stalemate the COVID-19 pandemic. Macon County Public Libraries are closed until further notice, and the Macon County Housing Department is performing exterior work only. They're not going in residences until further notice. So with the coordination and the hard work of many departments, aside from these that I've just mentioned, which again can be accessed on www.maconnc.org, we have been able to continue providing services to the public, and we will continue to do so, and just ask that, to listen to the advice that these healthcare and emergency services professionals are giving us. It is crucial to our ability to overcome this, and we will overcome it. So, Mr. Chairman, I have no further.
Any questions for the county manager?
No, I've got a question, but it may go back to Rocco. In your map that's up here, is that Haywood West, 7 counties? on that map that's a catch basin?
I believe what I'm referring to is, excuse me, this is Buncombe, and that's the catch basin. If I'm looking at healthcare systems with hospitals, the feeder hospitals are surrounding that area in outlying counties like ours.
Okay.
Additional cost, Derek, where you run numbers on that
Additional cost as,
to the county for implementing all of these.
well, we have additional cost as far as capital cost. It was very minimal. I mean, just installing safeguards in some of the offices, purchasing thermometers, any costs that are associated with this directly are being, of course, we appropriated the funding, $150,000, so we can better track any absences or out of work time. Finance has worked to set up specific line items that we can track those individuals that are out for the COVID-19 or related to the COVID-19. We followed the guidelines that have been provided to us as we have established that. I don't think, as Carmen says, this is a, we're getting into this for the most part right now, and I think that is something that we can certainly look back at when this process is over.
I think with the stimulus, 75% of that is refundable.
Yes, and that's why we've been so, every department is tracking, and we have given specific direction from finance to specifically track everything that you're doing with any department COVID-19 related, so we can get that refund to the max.
Most vulnerable groups in Macon County are long-term care facilities.
That's one of them, yes.
That's a biggie.
Yeah. Nursing homes, long-term care.
We have good
Assisted
rapport.
living.
We're assisting, helping them with their PPEs.
We did training for them. I actually invited all the long-term care facilities in Highlands, Franklin, anywhere in Macon County to come. And we did training for them prior to even having our first case. And so all of those, I have all their emails. We send them updates, information. I talk to them on a regular basis. And we're working with one real closely right now, and they're very, very appreciative of everything we're doing, and they're very, open to working with us. So.
Mr. Manager, is the machine, the sanitizing machine over a room at a time, is it due yet?
We have not received that yet, and
What do you think?
the shipping lines are held up right now. That's the last conversation I had with Mike, which was day before yesterday. But with that being said, again, we've been able to pull in staff from either other maintenance locations or offices that have been closed to assist with this sanitation effort. So we have more hands on deck. I know that their focus and priority, especially on the Health and Human Services building, to make sure that we're doing everything we can to prevent and to keep sanitary and prevent any spread that could be possible.
Thank you, Mr. Manager, for all the employees.
Yeah, thank you. Chester, are you still with us?
Yes, sir.
All right, now I'm gonna need assistance here as chairman. Item B of our agenda tonight is for the Macon County Commissioners to declare a supplemental state of emergency for Macon County. I'm a little confused at what that is versus D. That's item B. Item D says it's basically the same thing. Is it one and the same? I guess I'm a little confused on where we're going with this. Am I making sense?
I think at this particular point in time, you declare a state of emergency. At that point in time, we can
Discuss the specifics of it.
Proceed with the regulatory work that needs to be done or is under consideration.
So we'll be potentially declaring a supplemental state of emergency, but no specifics until we receive a report, looks like from
Correct.
Okay. Do we need a motion for that, or is it a consensus?
Which one are you talking about, Mr. Chairman,
Item B.
for Macon County Commissioners to declare, so are you wanting a motion to declare what?
Chester, is that consensus, or do we need to do that via motion?
I think you want to do it by by motion.
Okay.
And in this particular situation, I think it's based upon the reports that you just received from both the health director as well as the emergency management coordinator and the administration. As you can see, the situation has changed somewhat and considerable more information is available.
Okay.
The original proclamation.
Okay. Can we get a motion to approve a supplemental state of emergency? The details will be yet to come.
Do you need to speak before, Sheriff, do you need to speak before we vote on this?
Only thing I wanted to say is there any way we can put the phone, Chester's kind of muffled out for everybody out here, and it'd be good if we could put it up here on the counter.
Chester, can you give us the test 1, 2, 3, please?
Test 1, 2, 3.
That's better.
Yeah, that's better. I've moved the microphone around to your phone, so.
Okay.
So, Mr. Chairman, make sure that we all understand that you're asking for a motion on the supplemental proclamation, which includes all the wording therein, correct?
Not yet.
Okay.
We're just approving a state of
generic
emergency.
state of emergency.
A generic
Make
state
it
of
clear.
emergency. Then Warren's going to go into the details of it, and then we'll approve it again with
We'll
details.
talk about this.
Motion to approve for Mr. McCabe's report.
All right, we have a motion by Commissioner Bill to approve a supplemental state of emergency. Can I get a second, please?
Second.
We've got a second by Commissioner Shields. All in favor signify by saying aye.
Aye.
Aye. We've got 3. Commissioner, I'm sorry, I didn't hear. We've got a 4.
Are we discussing? I
The
don't,
the regulations will come next, Paul. So this just opens up the state of emergency, and then we're gonna talk about the regulations to be
we're
added.
voting to open the floor to you. I'm
Correct.
okay with that.
Okay, that's a 5-0 vote, Mr. Decker. So, okay.
You vote for anything.
So, all right, item C, to receive a report from Macon County Emergency Management Coordinator regarding the emergency regulations in regards to the COVID-19 virus emergency, which he is putting into place for Macon County, North Carolina, less the incorporated areas of Macon County, North Carolina, which would be Highlands and Franklin, under the Emergency Management Ordinance of the County of Macon.
Chester, do you wanna paraphrase that with anything before I get started?
No, I think you're well equipped to proceed with it.
Okay. First of all, I want to lay a little background out, and Paul, I think I actually want to answer your question that you had talked to Carmen, or at least provide an answer to you for a question that you had provided to him. Unfortunately, the way this process works is the development of these regulations falls on my shoulders to develop the regulations, and the way that we've come about these regulations is based on, wasn't just me. We've actually had several meetings with Carmen and with Robbie, and we've included the chairman and Derek, and actually made sure Chester had looked at all these. And we've had to make some very difficult decisions. And I think most of you know me, and particularly you, Paul, you know that I'm fairly conservative when it comes to what I want to do. And to be frankly honest with you, at this point we're at a crossroads. I'm not sure where we're headed. I would like to be optimistic and hopeful that the repercussions of the things that we're seeing will not affect Macon County in the way that it has happened in other places. However, the decisions we have to make, and they don't rest lightly on, I heard what you said about the economy, and that doesn't rest lightly on me. There's been several sleepless nights this week that Carmen and I have had trying to figure out which way is the best way for us to go with this. And to be honest, there's one way that we can go, that we can prepare for the worst and hope that the worst never comes. And if we do that correctly, the repercussions will be hopefully minimal here, with no deaths, or at least very, very minimal. However, there's an economic cost to that. The other method that we can take is we take a little more conservative approach, and then we wait out a little longer and we see what happens, which is probably better for the economy in the short term, However, the repercussions could be greater in the long term, just as Carmen had mentioned earlier. So unfortunately, at the time when I have to make that decision, and in concurrence with the people that we've talked about, we have no choice but to err on the side of caution for the health of our citizens. That's a difficult decision to have to make. It hurts a lot of people in various ways, and it's certainly not one that we take lightly. My concerns are fairly threefold, I guess, or more. We are essentially, and I would have never thought this 2 or 3 weeks ago, we're at war with something that we can't see, we can't hear, we don't know when it's coming, and when it gets here, when we discover it, it's almost too late. And we are basically handicapped with that at the moment as far as the ability to respond to that. The regulations that I'm laying in front of you there, and I'll be glad to talk about those individually, we could have been a lot more stringent, and we didn't necessarily all agree on various parts of this at the beginning, but we came to a consensus between the individuals involved with this to figure out what we thought was best for Macon County in general and the citizens of Macon County as a whole. There are other places around us that are implementing things such as this. Some of them are more strict, some of them are less strict. One of the things that we have seen very quickly this week, and the reason I wanted Carmen to leave this map up, there's a couple of things to point out about what's happening. Beginning of the week, you could look at Wake County and Durham and Mecklenburg, and there were some colors in there. And what's happened over the period of the last 3 to 4 to 5 days is the colors have gotten darker around those epicenters, and the color shading has expanded outward. And we've noticed that exponentially throughout the week, that from those centers, that seems to grow. And we've been fortunate. We've been very lucky with what we have here. But I honestly, at this point, I don't see any way out of the fact that circle is going to grow to where we're at. I told somebody the other day, they asked me about COVID, and I told them that I wasn't necessarily afraid of COVID-19 for myself. I'm concerned about the effects on our population that may not be able to withstand the effects of this, that perhaps their health conditions aren't to the extent of what mine are. But at the moment, my fight is not necessarily with COVID. Our disaster that we're attempting to avert at the moment is a failure of our healthcare system. We have to maintain that structure of that healthcare system, not just for the folks that may be affected by the COVID-19 virus, but for instance, if my neighbor had a cardiac issue and needed a facility or needed a bed or needed a process at one of these facilities here, and wasn't able to get that because the system is degraded to the point where it can't handle any more patients. There are other issues that we have to look at as opposed to just that one situation with the COVID situation, the COVID-19. So essentially what I would like to put into place are these regulations that you have in front of me. Some of these are a little more stringent than the governor's executive orders, and we talked about the governor's orders this week. The governor changed his mass gathering numbers from 100 to 50. That was actually after the CDC had actually dropped theirs down to 10, and we were hoping that those numbers would go to 10 so that we could be consistent. However, we didn't get there as quick as we thought we should, and to protect the people of Macon County, I think that's the option that we need to proceed with, is to go to 10 on our mass gatherings. The regulations that we talked about, and we were talking about motels and hotels, and I actually have some numbers for those. And this is one of the things that we've learned this week. We've learned that as other counties implement these, and Paul, you talked about a piecemeal approach to these counties as far as putting things in. Part of that, the governor actually backed up to the 50. That he went to 50 after he saw the piecemeal work of other counties and other municipalities dropping their numbers from 100 to 50 to make sure we were consistent and pull those numbers together. And I would have liked to have maintained that, because I'm one of those consistent people that I would like things to be smooth across the board. But unfortunately, the time came that I had to make the decision in conjunction with these folks that our best process, our best option was to take a step ahead of that. And that's when we started looking at the motels and hotels, and what we were seeing was people that were New York in particular, or some of these other areas, they were coming here. And it's not that we don't want these folks here. We want to protect our residents from any of the things that they may be bringing with them, whether they're unknowingly bringing it or not. And the only way to do that is to discourage these places from having rooms for those folks to come in as a respite area from an area of another community spread. Folks aren't necessarily listening to the instructions that they're being given at their federal level or their other state levels as far as staying home. You mentioned the stay-at-home order that, or stay-at-home recommendation that Haywood County put in place versus a shelter-in-place order. The difference between those, a stay-at-home order is more of it's a little less restrictive suggestion or recommendation. You can still go about your essential duties. You're not necessarily confined to a residence. When you get into a shelter-in-place requirement, that's where you basically stay on the property unless it's a true issue that you have to go out and get food or medical supplies or whatever. So the stay-at-home order that those other counties are putting in place is sort of tiered into the shelter-in-place process, and I don't think we're there yet. We've seen that compliance in some folks to keep us out of that, so that we don't get to that point. So that's why we didn't go to that point here in Macon County as of yet. We understand that there's some economic problems with the motels and the hotels and the bed and breakfasts and the rentals. I get that. I feel that. And you talked about reviewing it on April 14th. I can promise you that I look at that every day. And at the point when that needs to change, I'm not above standing here and telling you that needs to go away, whether that's tomorrow or 2 weeks or 2 months. I can promise you that we won't take that lightly, and me personally, I will look at that to make sure that as soon as we can lessen these, when we know that we've mitigated some of these issues, that we will take those restrictions off. I promise you that. There's also some other things in here that we realized this week that we didn't necessarily anticipate. We do have an airport, and we started to see an influx of folks that were coming in from areas that had a community spread, and sometimes substantial community spread. And there was no process of in which we would even encounter or interact with those folks when they come in, to make sure that we tried to keep any sort of problems as far away from our residents as possible. So that's why we need to implement that screening process at the airport. We're not telling those folks not to come, but we're telling them that there's some issues there that we're going to screen you when you come in. And if you're coming from one of these areas, what we want you to do is go to wherever you're going. If you're going to your second home, wherever you're going, and see if you can stay there for 14 days within reason, so that we don't spread this out to our other folks. And you've heard the term flatten the curve. That's the intent of what we would like to have in place with these regulations. So with that being said, Chester, do you want to add anything to what I just said as far as the process?
Chester?
Yes.
Are you there? Is there anything you'd like to add to Mr. Cabe's comments?
I think Mr. Caves handled it extremely well.
One other thing, that just so you understand that we didn't take this lightly. You start talking about numbers. I didn't know these numbers until we started looking. Abby and Wes and Andy have been working to make sure that we knew exactly how many people this affects. So we did not take this lightly. We looked to see exactly who and how many of these folks we're going to affect, whether it's for a week or 2 weeks or not.
You mean the private?
The motels, the hotels, the bed and breakfast, and the rental
Did you
places.
have any input, or are you talking about your team?
The team.
Was there any private people on your team?
No. In Macon County, just for your information, there were 24 hotels and motels that we located. 9 of those are in the city limits of Highlands, 5 are in the city limits of Franklin, and 10 are outside the city limits. We located 322 other rentals, whether that's campgrounds, Airbnbs, VRBOs, private rentals. There were 64 of those in the Highlands city limits, 19 in the Franklin city limits, and 239 outside the city limits. So we understand there's a significant number of those folks that we're going to affect. I also need to mention that the town of Highlands, they started experiencing some issues with their lodging and their rentals early in the weekend, and they actually implemented these same restrictions on the city limits as far as motels and hotels and the lodging. I believe it was either Monday or Tuesday, and actually amended it a day after. At that point, unfortunately, and it's not just from them, but this is from other places in the region, it happens here too. When you start seeing those actions taking place in other counties, if you start doing that in one part of the county, then you're going to push some other issues into the other parts of the county. And we actually changed, town of Franklin actually did the same thing with their state of emergency that they brought up here a little earlier. We actually changed the date on ours of the time that we suggested that those be closed to match the town of Franklin, so that we were all consistent with the same message that we were getting out to these folks. Probably one of the hardest decisions and the hardest processes I've been through in my career. We have had numerous conversations trying to figure out what the best options are for our citizens. And I can honestly say that although we'll be judged by what we do now, and we'll be judged over the next 10 to 15 years, I can honestly tell you that this particular document is what I feel like at the moment is the best option we have for the citizens of Macon County.
Thank you, Warren. I've had the privilege to sit in on some of these meetings this week. Commissioner Gillespie sat in on one as well, and I couldn't be prouder as a commissioner, and especially as chairman of this board, to know so the department heads and the crowd and the crew that we have working on this unprecedented issue. And again, distill a word from Derek, kudos to you, to Carmen and the sheriff, Derek, for working so diligently on this. I've been extremely impressed with the way you've handled it, the way you've come to consensus, the way you've studied all angles, and you have my full support on your recommendation. Mr. Manning.
If I could, just to add to what Warren was saying, I've received some emails from a few lodging establishments, including the largest room holder that we have in the county at Old Edwards Inn, saying that that they were supportive of the actions that this board was taking and are considering taking, and urged us to consider this and give it serious thought moving forward.
Okay, thank you for sharing that.
And I will say that on the flip side of that, we did deal with a couple of complaints that were addressed to our office over the weekend of folks that were concerned because lodging establishments were advertising at the time, come quarantine with us or come isolate with us, and they did not feel that that was appropriate for these folks to be advertising at a time when other folks are having issues. So we actually heard the other side of that as far as complaints on how that process was actually taking place.
I'm sorry, I saw you raise your hand there, Paul. Go ahead.
The overlapping state of emergency jurisdictions, Franklin, we're affecting that, or we just override?
Ours actually match. We worked very hard to make sure
they changed their
Town of Highlands went to 10 and the same restrictions on motels and hotels and lodging. Town of Franklin went to 10 with the same restrictions on hotels, motels, and lodging, and ours match. We actually have been in contact with them to make sure that
Town of Highlands is just the most restrictive of the three, correct?
it is, yes. And I do want to make sure that everybody understands motels and hotels are still open for people that are working. These people that we may have to have in here. We heard from Lisa Leatherman with Duke Energy to make sure that if we had a power outage, these folks are still welcome here, and they are. These places can still provide lodging to them, lodging to the homeless people that we may have to put up, lodging for those particular things. The particular area of business that we're trying to discourage, or there's folks that are trying to find that respite from an affected area to come here, which we feel puts our citizens in jeopardy. One other thing that I want to make very clear too, that we made sure of, if you read the regulations that are imposed there, if you look at item numbers D 4, it talks about rentals less than 7 days, and some folks you may not understand what that is. We actually know that we have a population that some people stay in a motel, and they may live there all year, but they do a week-to-week rental. So we tried to make sure that every population we could possibly think of that had a legitimate need to be here were still covered, and only address the folks that we were trying to prevent from spreading some sort of illness here.
Now, I know of some people who are conducting business in Macon County, non-related, stay in a motel.
Yes.
They're out.
No. If they're
Have legitimate reason to be here, business reason.
How do they do that before they can check into their motel? If it's a legitimate business thing, I'm thinking real estate. And we're talking about how this killed the real estate market, restaurant business. I'm a little puzzled, and I appreciate, Warren, I'm glad you're here, all you guys, and what you're doing. I do wish we'd had private sector input into these decisions. The most common theme I've heard today, and I've heard a bunch of phone calls today, is that people who are guaranteed a paycheck are making decisions that affect everybody else's paycheck that has no input into any of the decisions. I understand health versus the economy. A lot of people aren't going to get paid tomorrow.
one of the things we intend to do, and Carmen may have another process. One of the things we intended to do was obviously try and visit as many of these places, particularly the hotels and motels, and explain the process to them so they understand that. And it's part of that's going to be up to them. And if they need to ask the question of somebody that's coming in, are you working here, or what's your process, or why are you here?
Well, this is going to be viewed as just shutting down motels, though. I mean, that's.
We're not trying to do that. We built into this order the idea that you would have an ID badge from a company, plus on letterhead a letter saying that you have a legitimate business reason for being here.
What is a private individual coming to close a real estate transaction?
I think we've looked at the middle of the road of trying to be inclusive of the bigger picture for companies and corporations, and I know it affects individuals harder. However, and I just have to say, from a public health standpoint, our first concern is preventing illness.
I appreciate that.
And it is also with some mixed feelings to hear about the economics, but also to know that the ER nurses, docs, folks at the health department and other healthcare providers are actually putting their life and their families' lives at risk because they're trying to serve people who either, one, made a conscious effort to stay away and to practice what was done, and they, for whatever reason, got ill. But for others who decided that this was a vacation time and let's just have a good old blast down in Macon County, is putting those folks, healthcare industry, and first responders, which actually are now considered a priority group, especially those with symptoms, they're putting their lives at risk. So even though we are getting paid, I would say, how do you balance somebody putting their life at risk with somebody doing a real estate transaction? I would just say that if we have to make those decisions, it's not easy. We're trying to be compassionate on one hand and understand that maybe the government's bailouts and other things that they have proposed for industries and corporations and the private industries and private citizens will help to offset that loss for a period of time. I have no idea personally. I haven't seen any of it. But my concern is somebody who dies in our hospital. My concern is having one of our nurses become infected and have to see that person suffer. And they go out of work. and they have multiple problems as a result of it. And that puts the whole system at risk. So there's a balance here, and I appreciate what you're saying, but there's not a happy medium that everybody will be pleased. It's what we try to do, as Warren just said, is to strike a balance.
Yeah.
And no matter which side of this coin you're going to look at, somebody's not going to be happy. And we're sorry on one hand, and I'm not sorry in another.
Oh, I'm not gonna be unhappy. I mean, I appreciate what y'all were doing. And had there been some science or some evidence from the first state of emergency to this one, to base tighter restrictions on, then I would have comfort with that. And if we could review this, now on yours is a different document than what we've previewed.
That, Chester, you want to explain the difference between the regulation page and the state of emergency?
Well, actually, as you will know, the regulation page reads virtually identically to Section 4 of the supplemental proclamation. And basically what Section 4 says is that Warren Cave, as the emergency management coordinator for Macon County, has made the decision to impose those regulations. And the county needs to receive those with the understanding that those will be the regulations in place in Macon County until there can be a full discussion and a full and meaningful discussion between the emergency management coordinator and the Board of Commissioners, and the Board of Commissioners can otherwise fully consider and take action by ordinance to implement such regulations that it deems is appropriate and necessary to handle this current situation. And of course, the county will have that opportunity, as you'll see in Section 9. It fully contemplates that the board will be reviewing and reevaluating at its next regular meeting, Tuesday, April 14th, to determine whether or not there remains continued need for some or all of such regulations, or whether some or all can be eliminated. Indeed, there may be need for less, there may be need for more at that particular point in time, and we'll have more information. The discussion can be more complete, and will be in the context of a regular meeting at which the commissioners can actually take ordinance action at that time.
All right, thank you, Chester. Are there any other questions? And Paul, I just want to remind you, I know you didn't mean it, but I work dang hard for my check every week.
Oh, no.
I'm kidding.
I hope you're not living.
I'm kidding.
Mr. Chairman, this is a fairly simple at its core. This is something that these folks have worked hard on, that we don't pay enough to do what you do. Not only your folks, but people at the health department, all of our people that's come to ask me for masks. Do I have anywhere to get masks? This is not about a real estate transaction, or this is to keep them where they can be able to do a real estate transaction in the future. That's what this is about. And so it's pretty, in my mind, it's common sense. This is a whole lot less restrictive than most counties, to tell you the truth. And so with that, Mr. Chairman, I make a motion that we adopt the regulations set forth, imposed in Macon County by the Macon County Emergency Management Coordinator in connection with COVID-19 pandemic.
So it's a motion to approve the supplemental declaration of emergency, which
I think that
incorporates
would
the
be the
emergency
appropriate-
regulations.
Yes, I think that would be the appropriate thing, is to approve the supplemental proclamation of the state of emergency for Macon County, North Carolina. I think that would be the appropriate motion if that's what the board's inclined to do.
Is that what I just done, Chester?
I think essentially, yes, you mentioned the regulations, but technically the regulations at this particular point in time are imposed by the emergency management.
So that's what the
coordinator.
title of it is, so.
Yes.
But Chester, well, I'm sorry, you need a second.
No.
And then he needs a second, and then I'll discuss.
We'll get a second to the motion.
Second.
We got a second by Commissioner Shields. Discussion.
Okay, let me explain the process that gets a little confusing, and believe me, we've looked at various ways. The reaffirmation of the state of emergency is again you declaring that there is a problem in Macon County. At that point, that affirms the ability, and actually the regulations are, and Chester can give you the correct verbiage. According to our ordinance, the regulations come from me. So I'll shoulder the responsibility for those. I took those based on advice from the other folks, but ultimately it's my responsibility. And I'll shoulder the burden of those. And your adoption now of the state of emergency, the second state of emergency, or the amended supplement, the supplement to it, includes the regulations that I have enacted into that state of emergency as of today. Chester, is that the correct verbiage?
That is a very fair statement, and it makes it clear that the commissioners will be revisiting them and determining whether or not they want those changed one way or the other at the regular meeting of the commissioners on April 14th.
And statutorily, and according to the ordinance that we have, that's the reason that you have the option to adjust or change those is what by way of an ordinance at your regular meeting. But in between, based on the process, that's why the responsibility falls to me as the emergency management coordinator.
We're glad it does.
If this thing peaked in a week, then we're not at liberty to review it until our next 3 weeks from now, our next board meeting, right?
You're not, but I can.
But it would not be changed without the board voting.
We could actually, Chester, and the question was, if I look at this in a week and we say, okay, this needs to be changed one way or another, the process would be the same, that I would develop the same regulations with the same folks that looked at these this time, and we would bring it back to this board by way of a special call meeting. Is that correct?
I think basically you're in a situation until the board meets and takes action by ordinance to add to or take away from these regulations that you've imposed.
So in the matter of process, if I see in a week that these need to go away, then all I have to do is do the reversal on these and then make the information available to the board, and then that's it.
Yeah, and I think it may well be that if there's something that you think might possibly be controversial one way or the other, bringing it back in before the board, not a bad idea, so you can hear their thoughts.
So Paul, to answer your question, if we come into this in a week because I've shouldered the responsibility of putting these on, if that's changed in a week, then I shoulder the responsibility of taking that off.
And I don't mean to be picky, but we're talking about people's lives, health-related, stress in the private sector, in the economy, mental health. I mean, you're witnessing that. They're witnessing it at the hospital. This is a serious issue we're talking about. So if it takes a little while for me to just get my mind wrapped around it, I apologize for those who are able to listen to me barter through this. I know some want to get home early.
I'd like to add to that if you give me just an opportunity to do so, Ken.
Can I answer him 1 second? You don't need to apologize to me for anything.
I appreciate it.
I think that you need to sit here and you need to ask those questions. You need to ask the same questions that we had to ask ourselves this week.
And I'll be asking tomorrow.
And I think if you're not sitting there asking those questions, then perhaps there's some things that need to really be looked at. But I appreciate you sitting there and asking those questions and being that constituent for those folks. Because that's the same process we had to go through this week to get to this point.
Sheriff Holland?
And on that too, I haven't seen any other resolutions anywhere else that have been done with a date in the end. And we had a serious conversation and agreed as a group, an entire group, unanimously, that we needed to be able to show light at the end of the tunnel. And that's why we come up with the date that we come up with. We wanted to make sure, because we understand, all of us, just like you all make decisions on a monthly basis, we make decisions also. And we've lost sleep over this because we know people in our families and others that are going to struggle with this. So we wanted to give that light at the end of the tunnel by having a date and bringing us back up for subject. So I want you to know that we too agree with that and understood that. And that's exactly why ours has a date in it. Now, it's probably longer than you expected. You wanted, I think it's 19 days instead of 15 days or 10 days or whatever. But we agreed, we understood that, and that's why ours has a date in it.
All right, thank you, Warren. Any other comments or questions?
Yeah,
Go ahead.
I've got 3 or 4 questions. Warren, like you, this is absolutely consumed more time and effort and thought and loss of sleep for me since I've been a commissioner than anything else that we've had to, that we've been challenged with. So when I read through these additions that we talk about that are listed here, basically there's 3 things. We're going to have a group of 10 people, no more than 10. We're going to put some restrictions on lodging, and when you fly into the airport, there's going to be somebody there to greet you.
Correct.
You actually have one more, Mr. Gillespie, if you look at paragraph F.
Yeah. I read it.
Okay.
So we, and I'm only familiar with what I come in contact with, but we are working in multiple counties today, and those different counties and different cities all have, not all, but most have adopted some sort of something similar to this. Unfortunately, none of them are the same, so we're having to read them all and figure out what we need to do to comply. And from a kind of coming to where Paul's coming from a business standpoint, we've been able to continue to move from Macon County to these other counties and conduct business with little to no interruptions. And I think this is consistent with what I've seen there. From an agriculture standpoint, North Carolina Secretary of Agriculture worked with the governor's office, and through agriculture we're able to move freely with a permit that I can fill out, and as Jimmy is moving cattle for me, I give him that document. I'm sure you're familiar, and Jimmy can move freely to move those cattle or whatever else I need for him to do farm related. So I say all that to say that there's been an effort made to make sure, or to try to minimize the impact, the economic impact of this. And I don't think anybody on this board is any less concerned about the economic impact of this than Paul is. I mean, we all are, but I think at some point, you know, we've got to look at the reality of this thing, and maybe not for the worst case, but even if you go with erring on the side of caution, this can be justified very easily. But one specific question, and I'm pretty clear on if Tate Landscaping is going to come to Franklin and stay in a motel.
Perfectly okay.
That's simple enough. Going back to Paul's question about a real estate closing, if XYZ Corporation sends a principal and 2 attorneys into Franklin to close on a real estate deal, and they need to stay overnight in lodging,
Yes.
is that permittable?
Yes. That's commerce. That's business. That's permitted.
it's
So,
not-
so hold on, please. So, if while the principal was here closing that deal, he decided this is a good place, maybe I want a 4th home, and he comes back to close on his 4th home, and he needs to stay in the same motel, is that permittable?
If he's still doing commerce, yes. If he's strictly coming here to get away from an area or to try and remove himself from an area of that community spread, then no.
Okay.
But as long as he has a legitimate reason to be here, tied into commerce, then yes, that's
So,
permitted.
going back to Paul's question, that closing that was set up for tomorrow, that has been set up for 60 days,
Perfectly okay.
and they're gonna come in tonight and spend the night at Hampton Inn, and they're going to XYZ's attorney's office and do that closing tomorrow, and then
Go back out.
head back out. That will not be affected in any way by this.
That's correct, because we know that the only way that we could keep all of these issues out of Macon County with any form, fashion, or reason of a high percentage would be to stop everybody at the county line when they come in and screen them, and then isolate them for 14 days, because it takes 14 days or so for those things to show up. That's not possible. That's not feasible. Contrary to any rumors you may have heard, that's not what we're thinking in Macon County. What we will accomplish by that, we still run a risk that your real estate person or your attorney may have an issue when he comes in here. But we have lessened the chances of people he will come in contact with. We have lessened those numbers a little bit. We're not going to prevent it all. I hate to go back to that same question, or that same answer, but we're trying to flatten that curve out so that if we do have issues, they're isolated issues and it's not a bulk of issues at one time, and we still accomplish that with what we have here.
Warren, would you explain what respite means? That's what we're trying to dodge here. Coming here for respite, they're coming here for other reasons. The only reason they're coming here basically is to escape from where they're at.
That's correct, and there are two issues with that. They're coming here because they're trying to escape from a problem in the area that they're in, and there's two problems with that. And I understand that. Of all people, I understand that. There are a lot of places that I would like to escape to at the moment. That's probably not going to happen. If they come here and do that, then we run the risk of exposing ourselves to something from a higher concentration of this virus than we would normally be. And if they come here and they're typically from Atlanta or New York or some of these other places, we don't have the healthcare infrastructure, healthcare system to manage as many of those patients as they would while they're there. So we're going to put a further strain on our healthcare system.
Just a couple more questions, if I could, Mr. Chairman.
Sure.
As Mr. Chairman mentioned earlier, I had the opportunity to sit in on one of the meetings with folks that's been involved in this process. And like, well, first off, I appreciate Mr. Chairman allowing me to do that. But as he mentioned, you know, I appreciate the process that y'all have gone through. It was obvious to me, sitting through that one meeting, that there has certainly been some uncomfortable conversations had. And those were very necessary conversations that had to be had to be able to get to the center point, and something that we can all live with and we can move forward with. And I very much appreciate all parties for that. Mr. Manager, thank you. I'm going to put you on the spot now. And this is the part that I've struggled with in trying to determine, and I haven't. Is this enough? Because I firmly believe that once Macon County's colored, as we say at the farm, you just well leave the damn gate open. Now the cows are out. Is this going to be enough?
Usually when I stand up here, I'm pretty confident when I come to you. I can reasonably assure you that I'm 99% sure what I'm telling you is going to happen, and we're going to carry it out. I can't tell you that with this one. I have never experienced anything like this in my career. I've never seen anything like this. There's no planning that we can fall back on, an event that we can look at that's anywhere close to our generation to see how this would affect us. Everybody mentions the flu of 1918 and back early. That's similar, but that's different. Our population is different. We have folks that we've had folks from different countries that we've dealt with. I've had folks from 3 or 4 different states that I've interacted with in the last 2 days. That didn't happen then. We have more ways of communicating today. We can actually conduct commerce and our normal business easier today than we could have back then, because they didn't have the laptops and my physician is able to do his evaluation with me over the phone, face to face over the phone. We didn't have that back then. So I would love to be able to tell you that I think it's enough. However, the only thing I can tell you is that we think it's sufficient for the time being, and that we will evaluate that from day to day, and if that needs to be changed, we will make the appropriate changes. Thank you, Will.
One other question. Cleared up for me about the person who lives out of state, but they have a second home here. And that, can they come?
Yes, they can still come, but what we're asking them to do is to, and Chester and Carmen will tell me if I use the wrong term as far as isolate or quarantine, but we want them, that's fine, but we want you to stay there if possible for 14 days to make sure that you don't have any symptoms that could cause a problem coming out to our other residents. And be prepared to do that when you come. And I will give you an example. One of the groups of folks that we encountered yesterday, they were going to do that. They had already made those arrangements when they came in, and if I'm not mistaken, they came in with their bags of groceries when they came in. So they were well aware and were well prepared to take care of that situation when they got here.
Actually had just been through 2 weeks of the same thing at their home in their state, which I'll leave unnamed, but which is a hotbed for this virus. They just spent their time there, and they were wanting to get out of that because they'd spent enough time there and needed to come.
And I want to reiterate one other thing. We talk about enforcement, and there are obviously penalties for not following these, but our intent is the same that he follows with any other rules and regulations. And the same thing we did with the restaurant order that went into place last week. If we found somebody that wasn't necessarily complying with the governor's executive order, we didn't go in there with a heavy hand. We went in and had a chat with them and said, look, do you understand this? And this is why we're trying to get here. And that's what we will do with these. We're not going to go in there and attempt to cause an issue with everybody that either doesn't understand this or cause an issue. We're going to try and work with folks to make sure that we accomplish what we want without causing a lot of issues in the process.
Carmen, go ahead.
Just to make it a threesome here, is to say that these men are, as you are, men of integrity that I've had the honor to work with, and I wouldn't feel good about myself if I didn't say this. Initially, I wanted to close any access to Macon County from people from the outside. That was where I started as a public health measure to do what I thought was most sufficient to prevent the spread. And this is where we've come to. So it wasn't easy, and it wasn't taken lightly, and your question's well put, just as your questions are well put. It is what it is a compromise to say this is the best we can come up with at this point in time. We may need to go more stringent if things don't improve. And there have been studies of the 1918 flu outbreak between Philadelphia and St. Louis, and the spike that went into one of the cities with no social distancing, no efforts, and the one that didn't had the spike, and the one that did had the flat curve. So there is some modeling there, but all I can say is it was done with the best intentions for every component of what we could consider, and that we had facts and theories to work through, but we came up, I think, with the most balanced approach we have right now. But I thank the gentlemen that have worked together, including Derek and others.
One last comment, I should have. Now, the situation Carl said about the real estate transaction, it's not defined in this. I mean, this says an employer versus employee. So I understand there's some issues with that. And out of respect for you and what y'all have done, I can go along with this. I don't like the 10-day thing, but I don't think you're going to be able to enforce that anyway. You know, I don't understand yet. We've got the regulations. We've got the same regulations here, except we've got a date on it. I don't want to sit here and say I'm going to vote for something that we can't review. It's written on paper that we can't review for 19 days, whatever Robbie said. That's a long time. I pray God this thing ends quickly.
Well, we all
Everybody does that.
But, you know, I have a problem voting for something saying, hey, we'll say here, we'll kick back to March 14th and review it then. If it's, I can't support that. I mean, this is a day-to-day issue that you're well aware of.
And Paul, I promise you, I understand that and I respect that. But I promise you, we'll look at it day to day. And if I have to make those changes day to day, I'll make whatever changes need to be made day to day. From me to you, I promise you that I'll make those changes if they're necessary before we get to that meeting date.
But if we vote to close all of these businesses, you have the authority to open them.
Yes.
You do?
I have the same authority to reverse them as I do to close them. Correct, Chester?
Chester?
So
Yes, I believe you do.
why are we voting?
The ordinance specifically allows you to make the regulations, and I think that means what regulations are needed to address the emergency situation until the board and the emergency management coordinator can have full discussion, and the board's in a position to make any changes it needs to make to those regulations by ordinance.
So it takes board action.
Takes board action to do the.
Support
Yeah.
whatever you recommend.
Did you hear the question, Chester?
Yes.
Okay.
I'm sorry, I'm not sure I heard the question.
It takes board action
It takes board action to put in place what Warren is recommending.
Actually, it doesn't take board action to do that. He's already done it as an emergency measurement. The board is in a position to communicate with him and express whatever desires it has for either increasing or lessening those regulations until you have a regular meeting, at which point in time you can, if you decide to do so as a board, enact an ordinance to deal with any of these regulations.
Did that answer your question? The way our ordinance, the way our emergency management ordinance is written, the authority falls to me to make those regulations until such time as you have a regular meeting to consider them by ordinance. So therefore, it falls back on me to make them or to take them out until you have that regular meeting to do the ordinance to either make them, to have more review on them or to make them more.
There's got to be a full discussion between you and the emergency management coordinator, and there's got to be some ability on the part of the board to adopt an ordinance. And by North Carolina law, that has to be done at a regular meeting.
And Paul, that's not something that I take lightly. I promise you. It's certainly not been a pleasant experience.
Decision-making process, it's just that we're at odds on this.
In most counties, it's the chairman of the board, isn't it?
That's correct, but the way our ordinance is written,
Most counties, it's the chairman that makes these decisions. He don't have to consult with nobody. The chairman is, in most counties, every county that surrounds us, it's the chairman. And he makes the call. He don't even have to call nobody.
but in the way our ordinance is written, it falls to me and then it has to come back to you at a regular meeting.
That needs to be changed. Don't you agree, Warren? You do today, don't you?
It's a little late at this process.
Well, it's got me in mind. I don't want to go against you, Warren. I appreciate, you know where I stand.
I appreciate you, Warren, but we're gonna vote now.
Any other questions or comments?
Could you just, you used the term commerce business a while ago. I understand what commerce is. Could you fine tune that a little bit for me?
Commerce would have anything to do with a legitimate purpose as far as furthering the economy or any type of business-related activity that you were conducting in Macon County. And one of the things we can do is we can try and put out a fact sheet or something to these folks to answer some of those questions that they may have. And if they have any questions, please call our office and we will try and work through the.
Further the economy, that's clear.
All right, all in favor signify by saying aye.
Aye.
Aye, opposed? 4-1, Mr. Dufter. Mr. Manager, if you can proceed with distribution
Thank
of
you,
said declaration to the news media and however we need to get it out. Chester, please help me with this one as well. I know you know that I wrote a letter that I would like to send out to county residents. Is that something I can get a consensus on the board tonight, or do I need to hold on to that for a later date? I've got it with me.
I think it would be fine for you to communicate with your board members to see if any of them had any objections to you sending the letter. If they did, then I think it probably would need to go before the board for a decision.
You want me to read it, or just, how about you want me to read it out loud?
I think the public needs, I mean,
This is the letter. Go ahead, Chester.
I'm sorry?
Is it okay if I read it out loud?
I think that's fine. It's being presented as a proposed letter.
Right. This is a proposed letter. I'll let y'all know that I have noticed a few grammatical errors in this, but it's something that I would like to send out. Let me get a little closer to the microphone. It says, Dear Macon County resident, as the COVID-19 pandemic escalates throughout our state and nation, Macon County continues working diligently to mitigate the spread of the virus among our residents. Aside from adhering to increasingly stringent executive orders issued by Governor Roy Cooper, which have included business closures, prolonged school closures, and tighter requirements related to public gatherings, Macon County will be taking additional steps under our local state of emergency in a further attempt to protect our population and preserve the resources of an already limited healthcare system. Recent discussions with local healthcare and emergency management officials at both the state and local level have led us to believe it is not a question of if strain will be placed on our local healthcare system, but when. On March 17, 2020, at an emergency meeting of the Macon County Board of Commissioners, representatives of the HCA hospital system informed county leadership that the countywide capacity of the healthcare system included 62 hospital beds and 7 ventilators. This information, combined with the fact that approximately 30% or 10,200 of our 34,000 permanent residents are over the age of 65, placing them in the high-risk category for serious complications resulting from COVID-19, has led to great concern regarding local health care capacity from our elected officials as well as our local public health and emergency management professionals. Adding to this concern is the realization that the population of Macon County more than doubles in the spring and summer months as tourists and second homeowners begin vacationing and or coming to reside in their second homes. In light of the aforementioned circumstances, Macon County is respectfully requesting all second homeowners to remain at their current location and allow their secondary Macon County residences to remain unoccupied until emergency declarations at both the state and local level concerning the COVID-19 pandemic have been lifted. We apologize in advance for any inconvenience or undue hardship that comes as a result of this request. And at this time, we are in hopes that the transparency and concern which have accompanied this request will result in your understanding that it is founded solely in our desire to protect the health and safety of all Macon County residents. Kindest regards, Jim Tate. So my thought process behind this was that as we're just taking these steps to help limit what I would call somewhat of a tourism industry of people coming into respite, as Commissioner Bill said here, is that we also have the capacity that our population could double with people that have second residence or third residence or fourth residence in our county. But what I think it does is it provides them with a little bit more information that they're probably actually safer where they are than coming here. I don't think anyone on this board would want to keep anybody away from their property here if they own it. That's not the intent. The intent is again, health and safety of our citizens, and it's probably best that they stay where they are versus coming here and overtaxing a very limited healthcare system, evidenced by the numbers that I've projected there. I mean, just think about what I was stating there of 34,000 residents, and we have 62 hospital beds and 7 ventilators. As most of y'all know, I have a very close ties in the middle Georgia area from my parents being divorced and me spending a majority of my teenage years in that area. And of course I have still good friends, and I'm looking at the map that's on the board now, and if you'll see the blue in the very bottom corner of the Georgia cases right beside where it says 1247, that's Albany, Georgia. I've spent a lot of time hunting there, a lot of time hanging out with friends, and just from the cohorts that I grew up with that are still living there and that I still communicate with, their hospital system is on the brink of collapse because their ICU is full. They don't have enough ventilators. They're not keeping up with their day-to-day emergency activities, and it scares the fool out of me as chairman to know that that could potentially happen here. And I believe I heard Warren state that same thing in some of his comments earlier. So again, just a preventative letter. If any of y'all have any issues with this letter going out, I'll be happy to revise it, change it, or we can discuss not sending it. But personally, I think it's a good idea to let it go.
Don't you think, Mr. Chairman, that most of the folks who own a second home here have that realization? I think they would appreciate communication from the county. I really do. I think they would not only adhere to it, but the only thing I might add into the letter is to encourage them that if the house is going to be of use, not by them, but of who. In other words, if my family's going to be there, I'm not going to come, but I'm going to send my family. I think they can understand what we're trying to do. I think most of these people have second homes. The ones I've talked to that's about all I work for, they certainly have understood. One from Birmingham, Alabama, said, there's no way I can come. And the ICU beds, everything's full in the Atlanta area. They're moving them to Macon, Georgia. So that shows you where you're talking about middle Georgia. But I think they'd appreciate the letter. I think it's well crafted, Mr. Chairman.
Mr. Shills, you.
This doesn't conflict with the second homeowner coming here and going into quarantine.
No, sir, I actually reviewed the letter. Mr. Tate actually sent us a copy of the letter, and we agreed that that's probably a good suggestion.
Chairman Tate, I think it's a very well drafted letter. The only, and I like, because you're coming at from, it's an informational letter. It's not a mandate. It's just an informational letter. The only thing that I saw that perhaps could be added that I think would impact some of those folks, or certainly would impact me, is maybe just a brief description or some examples of some of the services that are not available, that they're accustomed to seeing. They're accustomed to making reservations and going out to dinner. They're accustomed to a lot of those type of things that I don't think are going to be available. They're not available now, and I don't know that they're going to be available.
That's a great point. That's an easy change.
I think that might be some additional
especially in the town of Highlands.
Yeah, that they would want to know.
Paul, you?
You're respectfully requesting, and I appreciate that.
You need a motion, Mr. Chairman? What do you?
No, I just want to nod ahead.
Consensus?
It's okay to do it. And I mentioned this in our meetings with our group here this earlier this week, that I thought it'd be a good idea to send this out.
Great idea.
Good idea. And Mr. Chairman, before we move on, we certainly have somebody here that's on the front lines, Dr. Gus Wilde, who has a load of so many patients you don't want to count them. So if Dr. Wilde, if you have anything to add to this, talking about somebody that sees everything, we'd love to hear from you.
Thank you, sir. Just to say
Should have had you up here sooner. My apologies.
No problem. Thank you for the opportunity just to say a few words. Like everyone else, I'm just so impressed with the group that's put this together and forward-looking. As Warren said, we've never seen anything like this before, so there are a lot of questions. There's so many unknowns. Changes every day. Every day I get emails, as you probably, from the state Health and Human Services. Things just change on a daily basis. I would certainly echo Mr. Rocco's presentation. I think that was excellent. There was one slide on there that scared the heck out of me, and it should everyone else, where it shows the exponential increase in cases once it gets started. And so I think everyone's efforts here tonight to just do everything we can to keep it from starting, because once that curve starts, it's a whole new ballgame. And really, it comes down to just thinking totally different than we ever have. I mean, to me, it's warfare and just requiring total different thought processes, what's important, priorities. Everybody's going to be making sacrifices economically or otherwise, and our hope is that we can keep the health consequences to a minimum. I know during normal times, you know, if there's an accident scene or something like that, generally the most serious patients are triaged first and flown to Asheville or wherever. On the battlefield, it's the exact opposite, and it's a situation where the most serious are last to go. People that have a much better chance of living so are the ones that are cared for. So it's getting to that mentality. It is at that mentality in some of the larger cities. Reading, you know, just stories from my colleagues. So it is going to be different. There's going to be sacrifices required from everybody. We're going to be required to think differently than we ever have about anything. So we can't really compare this. The only other thing I'll say, Carl made the point about Lowe's, social distancing. Obviously that is the key. I'll just hold up Exhibit A here, which was rather distressing. The Franklin Press from 3 days ago showing no evidence whatsoever of social distancing. I mean, yeah, these people are doing nice things, good things. They're, you know, loading food onto the school bus and manna, but as you see from this picture, they're right on top of each other. So I share your concern, Carl. I don't think we get it, and I think obviously this is an important thing, but anything we could still do to try to impress that, yeah, this is the real deal, this is serious. Certainly we're behind the 8 ball compared to some of these other areas, but it is coming, and I guess I would just encourage anything that you as a group can do to reinforce that it is important and it is a big deal will hopefully help prevent a almost unmanageable situation at the hospital, and the potential is certainly there for that. So I know everybody's trying to do everything they can to prevent that, but like I said, I think it's going to require a whole different mindset from anything we've ever seen. I think you guys have the best team here to manage this. I mean, I've worked with Warren for 25 years. Nothing he said surprised me. I think he's got it. But we need to, if we can give a little more of a wake-up call to our citizens, all the better.
Well, thank you for being here.
Thank you, Doc.
All right, can we get anything else? If not, we'll get a motion to adjourn.
Just one thing, the governor today, you'll be getting, if you don't have it, if Derek don't have it, they will have an electronic system set up for if we have to meet on any time. That will be in place. Attorney General's working out the details. So we did get that information today. But if we have to have our meetings electronically, that's going to be permissible from here on.
All right, thank you, Chester.
Thank you.
We get a motion to adjourn.
So moved.
A motion by Commissioner Bill, second by Commissioner Gillespie. All in favor?